This is Dr. Roger Knapp, pediatrician. I'd like to talk to you about croup. This is a viral illness we see mostly in the fall and sometimes in the spring, but occasional cases all year. And it's a viral infection just right here in this voice box area. It causes a cough that has a classic sound like a seal bark. Ooh, ooh. And it usually is more severe in the younger the patient. Croup is got a viral cause and rarely allergy related, what they call spasmodic croup. A wheeze is a high pitched sound and it sounds like this. Whereas viral croup is a seal bark cough, and they can get narrowing of the airways enough, especially in the younger babies, to cause what we call stridor. And that causes a noisy breathing that sounds like this. And if they end up that severe, then that definitely needs to be treated. The earlier we treat this, though, the more they breathe better, the less chance of going in the emergency room. And the way we treat it is several. One is to try and keep the humidity up, so run a humidifier, cool mist vaporizer in the room. Actually, you can crack open the window just a little bit and keep it cooler in the room, in the higher 60s. Also, we've had parents put them in the bathroom, steam it up like the London fog, or actually put their head just inside the refrigerator and breathe that ice cold air. Doctors treat it with steroids. The steroids are not dangerous in short courses, safe, and 2, 3, 4 days of steroids is really indicated. And once we've been doing that for the last 10, 20 years, I've really had almost no kids in the hospital being admitted with croup, as long as we can treat them early. The steroids shrink back the edema swelling of the trachea windpipe, because this is a viral infection right here. It hurts a little bit when you swallow, but burns right there in your windpipe when you cough. A little bit of hoarseness to the voice and that seal bark cough. As we get bigger and larger, our windpipe is larger, that swelling occurs, but it's not so bad. Generally, a lot of times doesn't need to be treated. May not have that honk sound, but it's still a chest cough cold that's right there burning, hoarseness to the voice. It's all viral and no antibiotics are needed. Occasionally we'll see an ear infection in the younger patients a week or two later, but the illness itself may run a little bit of fever, that seal bark cough. The steroids actually open up the airways but doesn't cure the cold, so they'll still be coughing for a week or two. It's that stridor and that bark honk sound that we want to try and control. It's obviously contagious like a normal chest colds. After 3 or 4 days they're not running fever, then they can go back to around other people. It's just that first few days that is contagious. I hope that clears up what we call the croup. Thank you. This is Dr. Roger Knapp.